This is revision of transtibial ACL reconstruction using anteromedial femoral drilling by Dr. Seth Gamrad at USC.
And we'll cut this portal under direct vision with an 11 blade. You can see here there's a vertical femoral tunnel and a torn ACL stump. First step of the procedure is to remove the ACL stump and perform a minimal notchplasty, just enough to see the back wall. Once we perform the notchplasty, you can see the vertical femoral tunnel visualized superiorly. And when we bring the camera into the anteromedial portal to look at the virgin bone lower on the wall from the initial femoral tunnel, we bring the camera back into the anterolateral portal and see that we've got plenty of bone to work with in this case. Next, we're going to mark the femoral tunnel position with an awl, about 6 millimeters anterior to the back wall. Next, we'll place a tibial guide wire more anterior than the previous tunnel. When drilling the tibial tunnel in revision situations, it's important to have patience because you're going to be going through old, partially reabsorbed fixation devices, possibly, and old graft. Here we're removing that graft stump. And next we'll debride the transtibial femoral tunnel with a shaver and backfill it with a biocomposite screw. No guide wire necessary. Just slide it up through the tibial tunnel into the femoral tunnel, twist it in place. That's going to protect that tunnel from converging with the new femoral tunnel that we're going to drill right now. Here is a six millimeter over the top guide, curved, brought in through the anteromedial portal to drill a flexible guide wire in the proper position for the femoral tunnel. It's important to rotate the camera anteromedial to view the condyle while passing the low profile flexible reamer. Next, we're going to drill this tunnel to a depth of about 25 or 30 millimeters. You can see here we're leaving a nice bridge of bone in between the two tunnels. The flexible guide wire is then used to pass a number 5 ethibond through the femoral tunnel. We can view both tunnels from the anteromedial portal to look at that bridge of bone between the two tunnels, and then retrieve the number 5 ethibond through the tibial tunnel for graft passage. Graft passage happens in 2 stages. First, pull the bone plug into the knee, then take a probe or a snap to direct the tip of the bone plug towards the mouth of the tunnel, and then give a second pull once the graft is lined up with the new femoral tunnel. Once the graft is fully seated within the new femoral tunnel, you can see nice low position and oblique position of this revision ACL graft. We'll take a cannulated screwdriver through the AM portal and impact that into place. I like to run a small guide wire 1 centimeter under power, then remove the cannulated screwdriver, then twist in the interference screw through the anteromedial portal. This is the final position of the graft after femoral fixation. We'll cycle the graft and fix it with a bioabsorbable interference screw on the tibial side, most likely with backup fixation